Well, hello everyone. This is Dr. Athney, and I'm a neurologist in Central Georgia. And this is a podcast in a series of podcasts where we're going to talk to medical students and learn about their path to medical school, how they got to medical school, what they're doing in medical school, and what they're going to do after medical school. So today, our guest is Un. He's a medical student here in Georgia, and I'll pass the microphone on to him so he can tell you a little bit more about himself. Go for it.
Hey, hey guys, my name's Un. I'm a third year medical student who's just freshly completed the core clerkship component of medical school. And as mentioned, I am going to school here in Georgia. And I've actually just rotated and finished rotating through Dr. Athney's site.
He thinks he passed. We don't know. We'll find out, right? So you went to college in Georgia as well. Is that right?
Yes, sir. So for undergrad, I went to the University of Georgia and I majored in nutrition.
Wow, nutrition. How did you find nutrition as a major?
So originally, I was like most pre-meds on the biology route, and I actually came across nutrition and I found it vastly more, I don't want to say more interesting, but it was something that drew me in just due to its applicability just right away. Transitioning, what you learned from the classroom that day and being able to apply it to your life, and also being able to give advice on that information to whoever is receptive to it as well.
Were you thinking of doing nutrition as a long-term career, or was that a stepping stone initially?
So originally for me, nutrition felt like a much more feasible goal in the sense that I didn't really know what a career would look like in either of those, from either of those majors. So with biology, for example, I didn't know what I would do if I didn't go into medicine or healthcare. And then with nutrition, it felt more like a subject that I was passionate about, and I could actually actualize some of the I guess the objectives with nutrition in the sense that, of course, you can benefit from it personally, and you can also counsel people regarding it. So from that sense, for a career path, I really didn't put too much thought into it, but I knew that the career path with just a nutrition degree was a bit limited.
Got it. So did you finish college rather and then go direct to medical school, or did you do anything else in between before medical school?
So as an undergrad, I had declared as pre-med, and for me, I wasn't necessarily so sold on going to medical school or being in medicine really, and that was a big point of contention between my parents and what I wanted to do. But I actually did spend a few years, uh, in between when I matriculated and, of course, when I graduated undergrad, and that was a personal choice. And during those years, I spent it, trying to get a bit more exposure to the healthcare field, as I didn't necessarily have too much exposure as an undergrad student, and it was a bit difficult for me to find those opportunities readily.
That's an interesting point. So, opportunities, do you think now, before I go on, are you the first person in your family to go to medical school?
Yes, so I am the first and only person in medicine in my entire family, actually.
W-
So it's
Which
yeah,
means everyone's going to be asking you about every single ailment they ever have had and will have, right?
yeah. That's why I'm taking my study so seriously because no, I'm just kidding. But at the end of the day, it is a bit of a, I don't want to call it daunting in the sense that I'll be the only one, but I really do pride myself on potentially being able to help my family members out, or triage their problems in a more productive way. And so that is a big motivator for me.
Yeah, healthcare in the US is so scattered and it's so fragmented that you need someone to really guide you. So that those are great personal ambitions. And so when you when you were going through the process and with being the first person who is even considering medical school in your family, how did you get advice or counseling on which path to take? Because it is a very difficult path for someone who's never been in the system.
I would have to definitely agree with that statement. Going to a really, really large undergraduate program and expecting to receive counseling regarding the path, it was unrealistic, and it still, I believe, is partially unrealistic in the sense that you really do have to just take ownership of the process. And as mentioned, it is exponentially more difficult when you have literally nobody in the field of healthcare, in your immediate family. But for me, it was a process of finding resources online, really, and whether that be discussion boards here and there, and that's a completely different discussion altogether, as that can quickly spiral to an unproductive level. But it was really a very piecemeal process where I was asking people who've, my friends who might be a year ahead of me or 2 years ahead of me. We'll have brief conversations, and I found those to be the most helpful, really, of everything.
That's great. That's great. And once you finally decided, yes, I want to do medical school, how long did that process take from after finding your future passion and actually accomplishing it?
So there was a really big disconnect for me as to what a career would look like as a physician, or what a day to day looks like. And I think that's partly because, one, I didn't really go to the doctor as a child, and I could probably count on one hand the amount of interactions I had with a physician. But um, at the end of the day, when I finished my undergrad, I really didn't feel like I had a good grasp of what healthcare really was and what it would look like in terms of its delivery. And we hear about all these, big problems with the healthcare industry, the pharmaceutical industry, and I hadn't even cracked the surface on, how to dissect that problem and, what that would mean for me as someone pursuing that field. So I really spent those years in between when I graduated and when I would put my application together to really definitively know in my heart that this is what I want to throw the rest of my life at.
So if you went through all of that process and you're on the other side now, you're in medical school, if that process was not successful for you, what would you have done?
I have that conversation with my friends and my girlfriend all the time, actually, and so it's something where you have to really candidly look at your own, personal strengths and attributes. And a big part of what is important to me is still being able to help people in a productive way. And I've always been interested in the human body as well. And, I've always been reasonably health conscious, and, I exercise pretty religiously as well. So um, I was actually considering PT at one point. And who knows how rewarding of a field that would have been for me. And, at this point, I will never know. But that was a serious consideration in the back of my head in the event that, things didn't pan out on this part of the journey.
Yeah, so I'm glad you at least had an alternate path. I know a lot of students who I've asked this question to, just undergraduates or even medical students, and they tell me I had no plan B. So on that note, for future students, future pre-meds or pre-meds or future MD students, is that something you'd recommend? Give it some personal thoughts, some self-reflection, and have a plan B? Or do you think most folks are successful in this path where a plan B is not needed?
I wouldn't necessarily say that everyone or not everyone, but the majority of people probably are not too successful with making the transition to matriculation. And, that's just an objective um, statistic.
Absolutely.
And I mean, you think about the undergrads who declared pre-med, and within a few years, you get a fraction of that population even applying for medical school. So, in a way, undergraduate is a very disorienting time. You finally have independence. You're making new friends. You find new hobbies. You find what your strengths are or what they're not, and navigating the process, along the way and stopping to really think, that doesn't necessarily always happen. And so I would actually encourage a plan B, because without that, you're kind of dangling parts of your self-worth for making this jump. And, I don't necessarily think that could ever really pan out to be as, I guess, what I'm trying to say is essentially it's a difficult journey, and you definitely should have a plan B and evaluate yourself candidly with with the few bits of time that you do have, and truly consider other fields and what those fields would look like for you on a day-to-day basis as a practitioner of that.
Great. And the fact that you took those years off, and I guess the common phrase that's used is gap years, um, and that has a lot of connotations to it. When it's done in the way you did it, I think it's a very positive thing where you took time off to reflect on your career choices, what you want to do. I know a lot of folks take gap years; they're forced to take gap years, but a voluntary set of gap years. Do you encourage that?
I think that phrase "your mileage may vary" is holds very true, but um, there were a lot of benefits that I got through my gap years, and I wouldn't trade that journey for anything at this point. Um, Granted, it wasn't this exponential, like, amazing progress through every step of the way, but I think as someone going into a field that is so demanding from an emotional maturity level, um, it's definitely something to consider, because as you transition from that undergrad time, you may be 22 years old, maybe 21 years old, and having the expectation that you will definitely mature into this profession. It's likely, yes, of course, you will mature, but the timeline in which everyone matures is vastly different. So for me, for example, I considered myself very independent. I considered myself emotionally mature, but if I were to kind of turn back the clock and be able to, have a conversation with myself back then, I would say I wasn't ready. And I say that very candidly because, there are parts of this journey, especially throughout the clerkship years, where I truly reflect back and think to myself, wow, like, I don't know how, younger me would have been able to have effectively, mitigated this stress or, compartmentalize some of these things. So that's kind of my stance on
No,
it.
that's great.
But
No,
of course, you have excellent people out there who can do it all.
right. No, no, no. But everyone's individual. That's exactly the point. That's wonderful. So you're in medical school, and so talk to us about your transition into medical school. So you're in, and now it's August of your first year. How is that transition?
So I guess to re-ask the question, are you asking about my transition into medical school,
Yeah,
the
yeah,
matriculation
yeah, yeah.
process?
So you're in. Now you have your acceptance letter, and you've moved to your the city of the medical school, and you got your apartment, and you're ready to go. So those the first few months, how was that transition?
When you spend a few years out of school, you can't help but to think about how you would have done things differently, in your undergrad time or any other time, really. Um, and so when I first got into school, or first got my acceptance, I thought to myself, wow, like, I know, one, like, this is exactly what I want to do. Two, my motivation is at an all-time high. Like, what can I do to really support myself and make sure that this is, the focal point? And I did something very, now I reflect back and I don't think that, that was the best decision. So clearly, I'm still making some mistakes here and there, but I actually signed myself up to live in a student dorm, and this was at the time of the COVID scare, really. And I call it a scare because we just didn't have enough information about it at that point. And so I really should have put more thought into my living situation, because I go from living in a home by myself, and it's, a lot of space, a lot of room, a lot of freedom, and to, putting myself into this cube with, dim lighting, and surrounded by undergrad students who are, 17, 18 years old. And you know, in my head, I was convinced that living close to school and, making it seem as though, this is the true focal point. And I thought I would be able to reap so many benefits through that decision. And that just was not the case. And it ended up being a bit distracting, actually. So that transition, that part was a little bit difficult, but I was very eager to hit the books. I was very, very eager, because it almost felt, throughout the gap years, I worked as a medical assistant for about 4 years of it. And so, by the latter half of it, I couldn't help but to be aware of my knowledge deficits, and I craved knowledge, because that's what's going to bridge that gap for me, and that's the next step. And so, in a way, I know a lot of people, they tell you about the pace in which med school goes, but even with me, with motivation at its all-time height, and me living in a student dorm, like, the pace of the preclinical curriculum is no easy feat to course through successfully.
Yeah, that's an interesting point. So, a lot of students think they have to learn everything to the nth degree. What's your advice on that?
So it is, I mean, I will say it's okay to let your mind wander and, find out more about specific topics and such. But when you're on a time crunch, it's really important that you're able to get the job done, which is, make it through each of the subsequent steps. And while the foundational knowledge is invaluable, it is incredibly easy to be, lost in the weeds. And I think that for that reason, it's really important to, have like a study group, or, peers that you can kind of consult with, that, you can find out essentially what, resources they might be using, or, um, how much time really they're allocating towards a specific topic. I'm not sure if that answered your
No, no, I
question,
think that's
but
good. Just, I guess, realizing that you can't learn it all, and just kind of getting a good group of
oh, no
friends.
way.
Yeah, yeah, and getting a good group of friends that'll kind of, you study together, and you're focused on what you got to focus on, and there'll be stuff that you will. I think most students should say, "I'm not going to learn it." You can't learn everything, and you got to voluntarily say, "I'm not going to learn that. I'll come back to it at some point in my career, which maybe never." But but you can't learn it all. So I think that's important for a lot of students. Just kind of realize that otherwise, their mental health suffers. I think a lot of students start getting depressed because I'm not learning everything I'm supposed to be learning, and I'm paying for this major education. That's just part of this education process. You're not going to learn everything. And so, as you went along in your pre-clerkship years, was there anything that you loved about the pre-clerkship years?
I really loved being in the anatomy lab. I thought that, that type of experience is so invaluable. Actually being able to learn from a real human body versus, what you see in a textbook or PDF file. I think that type of tactile learning too, that was tremendous for being able to cement things for me. Another thing that I really liked was the my curriculum tried to incorporate ultrasound education through, you know, correlates in our specific modules. And I also really like that too. Of course, it's kind of like the kind of going back to being able to directly apply what you learn, and kind of being able to still work with your hands and, kind of piecing together your knowledge of anatomy and, that spatial intelligence is really put at work.
Regarding the ultrasounds, I think your school is one of the very few in the country that incorporates that. And on the back side of it, when students from your school applies to residency, um, the residency programs are amazed at y'all's the entire application class, your skills, because no other class has that, no other student has that skill. So something to be very, very proud of. So kudos to your school for doing that, and kudos for you guys to learn that. And so, as you entered your clinical years, what do you think was the transition that was good and the bad in that transition, and what did you love about, or what have you loved about your clinical years?
Hmm. So I think for me, having the gap years where I, worked in the medical field. So, of course you're coming home, maybe 6 o'clock or so. And at that time, I hadn't gotten my MCAT score. I hadn't taken the MCAT. And so it was this journey of, or this, I don't know, I don't even want to call it a journey because it wasn't long enough, but there was that time period where I was studying for the MCAT while I was still having this full-time job. And, it's surprisingly very similar to clerkships. You get home, maybe 6 or 7 o'clock, and, you have to knock out a good chunk of information. And so that kind of similarity, it felt very similar. I almost, I thought back to how I was doing at that time, and it's about the same. And I don't want to say that MCAT content is, similar to the nitty gritty parts of a shelf exam, but that transition wasn't so bad for me. And I actually really thoroughly enjoyed clerkships. And I actually really enjoyed the fact that, you can get that, work experience and the studying aspect. And that was something that I actually really, that really pushed me to go to school, in the sense that, you know, I was working at an ENT clinic. So there would be things that I would know what the treatment plan is, but I wouldn't know any of the basic knowledge behind it. And so I really didn't have that level of nourishment where I could come home and like really crack into it and like find out. And so being on clerkship, it's super cool because you find out something that you're terrible at, you just know nothing about, and you go home and you try to bridge that gap and get rid of that deficiency. And so it's a very rewarding process.
Yeah, so the way I look at the preclinical education is the foundation. So, when you're working as an MA or in a doctor's office without that foundation, you don't know what you're supposed to know. You don't know what you're supposed to learn, and you're just kind of going through that life. But when you're in clerkship years, you've had this foundational education. Most folks struggle through that first year because it's a lot of material, but you'd be surprised how much stuff most students absorb. Um, Despite the difficulty. And when you get to clinical years, now you're building on top of the foundation. A simple example, most, if you're not in the medical field, if you haven't gone to medical school, most folks don't know what the anatomic position is. Now that's day one of medical school. That becomes part of you. And so now when we talk about, the right, left, or the medial or the lateral, these words that are used all the time in medicine, now you know what that means, as opposed to just kind of going with the flow and seeing what your doctor is doing. So I think that's why medical school is the way it is. But I'm glad you said what you said, that you've enjoyed building on what you've learned in clinics and learning from those experiences, because that is what the clinical years really are. That's great. That's great. So looking forward in your career, what do you want to do after you finish medical school?
So I've declared ENT as my specialty, and so of course, hopefully, my future is as an ENT resident, and so that would
So
hopefully be
explain,
five
so if you
years.
could explain to the audience what that means, declared ENT. Does that mean you're, committed with a gun to your head, or is it just, just explain what that means?
So it can mean what it means to you, and I think a big part of it is kind of identifying to your school, hey, this is what I want to do. And, some schools may provide you resources or, opportunities that really help to put your application together, geared towards that specific specialty. And when you declare a specialty, it's not to say that you can't, you know, change your mind or have another specialty in mind as well. So in short, I don't necessarily think that it's, something that's incredibly important in the sense that it's not a binding decision. But for me, it is something that I say as a means to, let people know that I truly am serious about pursuing this.
Great. So ENT. So how'd you? I know you worked in an ENT office, but is that what influenced you to go into ENT, or was there something during medical school that got you into the ENT world?
So I'll say I entered medical school with a considerable amount of bias, and that's because I worked a few years in ENT. And a big part of me being aware of my biases was the fact that I made a genuine and honest attempt at being interested and putting myself in an in positions to be interested in the various specialties. So throughout the process, a lot of shadowing, and even during clerkships, um, I wouldn't hide my intentions, of course, but in the back of my head, I was thinking, you know, I'm trying to find something else that I'm falling in love with. But I found that anytime, more of the, ENT related field would come up, like my eyes would just, and I would be infinitely more invested at that time. And, who's to say that, it's not because of the considerable bias that I have, but when there is a certain level of passion that you have towards a specific field, I've gone I've gotten to the point where I'm like, I'm not gonna try to suppress that, and I'm gonna see where that takes me. And a big thing for me is I worked in an ENT clinic, so it was at a private practice as well. So I really didn't get to see some of the more involved things within the field, specifically more of the head and neck procedures or the oncology. And when I got to medical school, I made it a point to, really try to see and shadow the physicians who are doing those procedures. And, it only confirmed what I was already interested in. And, being able to see, of course, bread and butter stuff in clinic, but then also the more involved things. And that's kind of pushed me over the edge to really be super duper interested.
Oh, that's great. That's great. And so to the next step, which would be applying to residency and getting into a residency. How are you preparing in this transition phase between medical school and residency?
So I think I'm kind of adopting the mindset of everything builds on top of itself. And while, I mean, of course, the transition from third, fourth year and submitting your application, that's a time like no other. But I'm doing things like, of course, making sure that some of my, objective measures are a bit, taken care of in the sense that, of course, taking care of research, taking care of how I'm scoring on these standardized tests. That's a given. But I'm kind of approaching it more as, within 2 years' time or a year and a half time, I need to be transitioning into, being a resident regardless. And so, um, just understanding that the effort that you put in is, even at this point, it's going to continue to build, and it's going to help you throughout the entirety of your career, no matter what specialty you go in. That's kind of how I've been grounding my efforts and kind of motivating myself in a way.
That's great. That's great. And fast forward, let's suppose you go through the process, and in 5, 6 years, you're a full-fledged board-certified ENT surgeon. Uh, where do you want to practice? What are your long-term goals? And I asked this in a weird way, in the sense that you're going to look back at this video in 6 years and say, "What did I say?" So yeah, what are your thoughts now? And we'll reassess in 6 years.
Right. For me, location is very important. And I've grown up here in Georgia for almost my entire life. And a lot of my opportunities have come from here. Of course, you know, I'm Korean, and I retained my citizenship up until I was about 20 years old, I want to say. And so for a long time, I thought that I will have to go back to Korea and I will proudly serve my country in the military for the 2+ years that is required. And so I would say I'm a very duty driven individual. And I think it'd be very meaningful and special for me to be able to give back to this specific community in Georgia. But at the same time, of course, you know, 5, 6 years from now, I'll be married potentially and with kids. So all those factors considered, it's a very personal conversation that I would probably have to have with my significant other. And in terms of academic medicine or private practice, that's something that I'm still mulling over. But a big draw to academics would probably be just the fact that there's so much information coming out, and the way that we approach specific problems seems to change, not too drastically, but it does continue to change. And being up to date is incredibly important. And staying on the academic side of things, and kind of clue you into those new things coming out. So that's a big draw for me, actually.
Well, that's great. That's great. And just so in the final few minutes of this podcast, do you have anything to add? Any words of wisdom? Anything to tell the audience?
Um, Medical school is incredibly challenging, yes, but I think this is something that I've gained with years in between. But understanding who is important in your life and what is important in your life and what you're willing to really compromise or sacrifice, and setting that hard limit is incredibly important. As you find yourself kind of dangling your self-worth for like objective scores of being an awesome student, you have to dial back a little bit and think, like, what were you willing to sacrifice on this journey? And like, what, like, is that really truly what you intended to do on this, like, before you even course this journey? So having that balance is incredibly important, and the only person who can truly tell you what that balance should be is yourself. And without that candid time of reflecting and like truly reflecting, it kind of sets you up for a really rocky journey if you're not aware of those things. So keep those things in mind would be advice that I would give.
That's great. That's great. So in broad terms, in my mind at least, there are two very important concepts that I think medical students need to be successful. One of those is maturity, and the other one is communication. And hopefully, in the last half hour, you've seen that Un has incredible level of maturity and an incredible level of communication skills. And so, no, I mean, by the way, for the audience, this is completely unscripted. There's zero script in this. So, yeah, so he's hearing those for the first time come out of my mouth, and so it's true. And so I think those personal traits are very, very important. So whoever's listening, if if that can be of any good advice, quote unquote, take it, because that's very important. And attendings, preceptors, doctors notice that very quickly, and they can tell who's on the right path and who's not. So things to work on, from a self reflection standpoint. But anyway, so we'll kind of conclude this edition of this podcast on ENT with UN. That's a nice name for it, ENT with UN, right? So,
Yeah.
but on the next podcast, we'll have another student who'll describe their journey, and hopefully it'll help, the audience at large in making good decisions in this crazy journey of medicine. So we will say goodbye here, and see you on the next podcast. And I'm learning how to do this, so I'll tell everyone out there, do the ring the bell, I guess, subscribe, and do some likes and all that fun stuff to make this podcast successful. All right, guys. Thank you.
Yeah.